At the complete other end of the spectrum, about the people that we could probably do without in our country right now, every now and then we are forced to ask ourselves, who actually runs this country? Now, sure, we have the dog and pony show of an election every 3 years or every 4 years, depending on whether it's state or federal. They'll fine you if you don't vote for the local councillor in the ward of which you probably don't even know which one you're in, let alone who's actually running. But largely, much of the establishment view inside of establishment media or establishment politics or establishment bureaucracy is that our role as citizens is to shut up and pay taxes. That's it. Don't expect fairness, don't expect logic. Hypocrisy is only something that we will apply, not something that you will be able to apply to us. Now, in Australia, the way the system is supposed to work is that a government gets elected and then the bureaucracy has to carry out whatever the elected representatives say is the policy of the country. It doesn't work the other way round. But under the cover of COVID, we have seen the chief medical or the chief health officer, essentially the health bureaucrat, not just being the chief advisor to the decisions made each and every day, but they are now the people of whom the elected leadership asks permission before doing anything. A perfect example of how broken this system has become is a policy that was being put together that agricultural workers would be able to freely cross across borders if what they were doing was their work. We're not talking about people who want to find a cheeky way to be able to have a holiday on the Gold Coast, people who want to slip from Broken Hill down to wine country in South Australia. We're not talking about people who want to go ooga booga with the virus and scare the good people of Western Australia. No, a system was being put together by the Federal Agriculture Minister and the supposed people who lead our country that the workers in our country, in agriculture, would be able to freely move around. Here's him explaining it.
Formatting practical common sense solutions for regional rural Australia. We don't have the cases that they do in Metro. And this is what we're just saying to the premiers. Talk to your chief medical officers. Understand that you are making decisions predicated on clusters that are severe in capital cities. They are not in regional areas. We can create avenues of commerce for regional rural Australians to continue to feed and clothe you. And this is why the Prime Minister has been very forward-leaning in trying to bring these premiers together. But ultimately, they have the sovereign right under our federated system.
Here is the Prime Minister extolling the values of this idea, the elected government with an idea, the Prime Minister talking about it at the Daily Telegraph's Bush Summit, which I was at in Cooma last week.
I know that state borders are putting enormous stress and strain on Australians, especially those in regional border communities, keeping people from their work, restricting farmers' accesses to their property and their markets. I've had hundreds of letters because much more needs to be done to ensure that these border movements are made easier, but ultimately to ensure that we get the borders open again.
But under the cover of COVID, who actually runs the joint has changed. Because guess what the chief medical officers, guess what the bureaucrats have said to the people who we elect to run the country? No. They have said no to a system where agriculture workers are allowed to cross the border to go to work, to do their job, to keep this sector going. I'm almost sick of saying it, but it remains absolutely the case that the reality of the virus in regional Australia is completely different to that in metropolitan Australia. There is none in Tasmania. There is none in Western Australia. There is virtually none in the entire state of South Australia, but there's definitely none in regional South Australia. There is none in fair dinkum, remote, regional, agricultural-focused Queensland, and the same in New South Wales, let alone the NT. The problem is still Melbourne. The problems are still dotted around Sydney. But the health bureaucrats have told the people that you and I elect that we spend all of our time, all of our energy fighting about who gets to run the joint. Well, you have seen today that when it comes to COVID, it's people you didn't elect. Now, will the politicians overrule these people? Or will they hide behind them like they have in every state? Where these people whose solution to the road toll would be banning everyone from driving a car, that they can't see that we are not an experiment of health, but we're a country, a community, people who should be able to work, people who we should facilitate to be able to work. So let's see what happens. Now, I know what will probably happen, which is the state premiers that are closer to an election dig their heels in. The ones that are further away will try to find a way for their publics to be able to go to work. And if you are somebody who is about to sit in judgment of a premier who has destroyed their economy in order to follow like a lemming what the health bureaucrat says, then don't reward them with another term in office. Otherwise, you are re-empowering the system that you didn't vote for. You are re-empowering the expert to not just be there to give advice, but to take over. We have seen an abdication in leadership in this country. We need to take it back. We need to tell the people who we elect that our role is not just as the idiot taxpayer. We are the people who want to see our families, who want to mourn our dead, who want to support other businesses, or want to be able to freely move in order to do our business. Distanced, with the app, and clean hands, and even a mask if you want us to. But pretending that COVID is around every corner when it really is not anymore is a fundamental lie. Who is in charge of this country right now?